Hello, my name is Catherine Leblanc and I'm a faculty lecturer at the Ingram School of Nursing of McGill University. In this video, we will demonstrate how to withdraw medication from a vial, in this case insulin, as well as how to administer the medication via the subcutaneous route. For insulin, one thing that we must do before is take the patient's blood sugar. The value that I got was 13.9 in this case. One thing that you have to know is that this value is only good for 30 minutes. So once you've taken the patient's blood sugar, you must administer the insulin within 30 minutes. So before we begin, you must gather your equipment. So you will need your vials of medication, an insulin syringe, a medication label, alcohol or chlorhexidine swab according to your hospital policy, dry gauze, your sharps container, as well as hand sanitizer. Before preparing your medication, you must perform your 10 rites of medication administration. So the first rite, the right patient. So you're going to look at your MAR as well as your sliding scale in this case. You're going to make sure that you have the right patient. And when you get into the patient's room, you're going to confirm the client's identity with their ID bracelet. So this is for the right patient. Now for the right medication. So now it is 7 o'clock in the morning. According to my MAR, I must give Humulin R and Humulin N. So I'm going to look at my vial and ensure I have my Humulin R as well as Humulin N. So I have my right medication. In terms of right dose, so this is where your calculation needs to happen. So it is 7 o'clock. I need to do my sliding scale. So my sliding scale, my blood sugar was 13.5, so I must add 4 units of Humulin R. So I have 4 units of Humulin R. At 7 o'clock, I also have my regular Humulin R, which is 6 units. So my 6 units plus 4 units of Humulin R is a total of 10 units of Humulin R. And I also need to give Humulin N 4 units at 7. So my right dose is 10 units of Humulin R according to my regular insulin and sliding scale, and 4 units of Humulin N. For my right route, according to my MAR, the route is subcutaneously, so this is how I'm going to administer the medication to my patient. As per time, we said it was 7 o'clock in the morning, so we have 7 as well on our MAR. For the 5 remaining rites, we're going to do them at the patient's bedside. We're also going to ensure that the patient has no allergy to that specific medication. So now that we have our first 5 rites, we're going to start preparing our medication. So we're going to perform hand hygiene and get our medication ready. So as insulin is a high alert medication, we will need to do independent double check with a second nurse. So first of all, we're going to take both our vials and we're going to roll them into our hands to make sure that the solution is homogeneous. So we're going to roll them until we are satisfied with the consistency for both the vials. Now we're going to remove the dust cover of both vials and proceed with disinfection. You have to take a different alcohol swab for each vials. Each vial should be disinfected for at least 15 seconds with alcohol, and you have to allow it to air dry completely. So after 15 seconds, you're going to let it air dry. Now for insulin, you need an insulin syringe. So you're going to get that out of its package, and you're going to withdraw the correct amount of air that you're going to inject into your patient. So we said for the Humulin N, we had to give 4 units of Humulin N, so we will withdraw 4 units of air and inject it into our vial. This way, so you're going to access your tube and inject 4 units of Humulin N. Now, for the second insulin, we had 10 units to give. So you withdraw 10 units of air and inject it into your vial. Now, you're going to withdraw your Humulin R first. So you're going to withdraw your plunger until you have your 10 units. You want to avoid having air bubble, so sometimes it's easier to withdraw a little bit more and then get rid of the air bubble after. You are going to recap using the one-hand scoop method to avoid needle stick injury without contaminating your needle. So now we're going to flick a little bit our needle to get rid of the air bubble and make sure that we are at the correct mark. So right now I have 10 units of Humulin R. So now I'm going to ask for a colleague to come and help me to do the independent double check. So Dajna, now that I prepare my Humulin R, would you mind doing independent double check with me? My patient blood glucose was 13.5.
Okay. So 10.
So this, and this is my Humulin R.
Perfect.
Thank you.
Welcome.
So now that we've verified our first dose of insulin, we're going to prepare the second one. So we're going to grab our Humulin N and withdraw directly from the vial. We already injected the air in our vial, so we don't need to do this again. When withdrawing the Humulin R, we must be very precise, because if we go over, if we take more units, or if we take air bubbles, we won't be able to remove them after, because we won't know which one of the insulin we're pushing out of the syringe. So we must go very, very slowly in order to get the precise amount of Humulin N. So, like this, I'm going to double check that I have a total of 14 units, and I'm going to again do independent double check with Dajna. So Dajna, I withdrew the second insulin, which is the Humulin N. So would you calculate, please, how much you would give? So this is what I have, and from this vial.
Perfect.
Thank you.
Welcome.
So now we have our medication ready. So we have a total of 14 units of insulin, 10 of R, and 4 of N. So I'm going to write my label to make sure I know what's in my syringe with my patient's name, the MRN, the medication, Humulin R, 10 units, and Humulin N, 4 units. I'm going to write the route, the date, the time, and my initial. This label, I'm going to put it on my syringe, making sure not to obstruct my, my dose of medication. So now that I have my medication, I'm ready to go into my patient's room to administer the medication. So now that your medication is ready, you're going to go into the patient's room. Make sure to always knock on the door and ensure privacy once you get in. So before administering the medication, you must again continue your 10 rights of medication administration. In this case, our first right, the right patient, you have to ensure with the patient that you have the right patient. So you're going to ask them for their name and their date of birth, and you must confirm with the bracelet to make sure the information you have matches the bracelet. So now you have the right patient. You're going to then do the right assessment. For insulin, specifically in this case, we assessed the blood sugar of the patient before starting preparing our medication. So this is part of our assessment. We can also assess if there are any signs of hyper or hypoglycemia. Then we're going to proceed with the right education. So we're going to tell the patient about the effect of insulin as well as possible side effects. The 2 remaining rights, we're going to perform them after the medication's been given. So we are now ready to give our medication. For landmarking as of subcutaneous site, for this patient, we're going to use the outer aspect of the arm. So when you are choosing this site or any subcutaneous site, you're going to choose the angle of insertion according to the amount of skin that you're going to be able to grab onto your patient. So you chose this site, so the outer aspect of the arm, so you're going to proceed with disinfection of your site. For the purpose of this video, we're going to use an injection pad. So you're going to disinfect the skin for 15 to 30 seconds in a back and forth motion. And you're going to ensure that it dries completely for at least 30 seconds before injecting your medication. You're going to perform hand hygiene if it was not done previously, and you're going to put on clean gloves. So, now that your site is dry, you're going to be ready to inject your medication. Ensure that your sharps container is close by so that you can drop your needle right away. So you're going to open your medication. You're going to grab onto your skin. So in this case, I have more than 5 centimeters, so I'm going to inject my medication at a 90-degree angle. So you're going to go in one quick motion at 90 degrees. So 1, 2, 3. You're going to stabilize the needle with your non-dominant hand and push the plunger slowly. As those are very small volume, you can inject it quite slowly. You're going to leave the needle in for a few seconds to make sure the medication has time to diffuse, and remove it the same angle you use for insertion. I'm going to put it directly into the sharps container, and if there is bleeding, you can apply a dry gauze on the site. You don't want to rub or press hard on the skin. Once you're done with your technique, you can cover your patient, and you're going to finish with your 2 remaining rites. The first rite documentation. You're going to ensure that you write in your MAR and sliding scale your initials with the dose that you gave and the site that you use. For the rite evaluation, you're going to go back to your patient at peak of action and test again your blood sugar to ensure it's within normal values, as well as assess the presence of side effect in the patient. Before exiting the room, ensure to do hand hygiene and to reposition the patient in a comfortable position. Thank you for watching this video.